Bleeding from the anal area or bleeding in stools is a very common problem. Unlike what most people may assume, we see a lot of patients coming to us. Now, the most common cause of bleeding is a simple problem like a fissure or a hemorrhoid or something like that, and patients usually present with simple constipation, difficulty in passing bowel motion or straining while passing stools, and they have some amount of bleeding. They present to us for evaluation. But what is important to know is how to differentiate a bleeding which is coming from hemorrhoids or fissures and something more important like cancer or inflammatory bowel disease. So, the first thing is you have to look at the age of the patient. If it is a young patient and the patient is having a bleeding which is not routinely accompanied by constipation, and you feel that the blood is mixed in the stools and there are repeated episodes of bleeding, sometimes very profuse bleeding, and it is continuous, it does not stop over a period of time. Now, these are ominous signs or red flags that this patient should be investigated further, and the most favored means of investigation is to do a colonoscopy and find out if there are any ulcers or other problem which are present in the colon which may be responsible for the bleeding. Similarly, if you have a patient who is anywhere in the elderly age group, maybe 40 years or above, and you feel that the patient has fresh red blood in the stools or there is intermittent episodes of bleeding with altered bowel movements, then these patients should be seriously investigated and should be offered colonoscopy. The point that has to be noted is that even a negative colonoscopy is very, very reassuring. If you have a patient with bleeding and you have done a colonoscopy and you find there is no other problem and it is only hemorrhoids which is the problem, it is very good. But at the same time, you should not miss out on major problems like cancer or ulcers just because you are treating the problem as hemorrhoid, whereas the problem is lying somewhere else inside.